we as a nation, with great privilege, are embarking on a great debate. I have yet to speak to many Americans who think we cannot do health care better. The overriding input that I have received to date is that if we do nothing, we as a nation, elderly, young, men and women, rural and urban, will suffer greatly. And we have seen that. So, the great question is, what do we do? And how do we build enough consensus so that what occurs, we can all have some buy-in in? Now, people have been very objectionable to this document. Others have been passionately for it and in favor of it. But it has given me great heartache because many people on both sides have said things about this bill that are simply not true. Now, if I had to vote today on this document, I would not vote for it. But not for many of the reasons that you hear about in the mass media. And some of those reasons need to be dispelled. There is nothing in this bill, nothing about abortion. In fact, federal monies by federal law cannot be used for abortions, period. Something called the Hyde Amendment. It's federal law. And those who read of this bill and develop great emotions should understand that. There are other things to be concerned about. I got an email, all capital letters. Oh my goodness, page 425. Mandatory euthanasia counseling. Don't laugh because it's a very serious issue. How many saw that email? I may have seen that. It's been going all over. Let me just do something here. It's not easy reading. It really isn't. It's not easy because it's a law, and it's written by lawyers, and it has to be very, very precise. Well, the problem is, the comment was, well, let's fix that. I'm not sure I want laws that are not very complicated and very carefully written. I want the experts, and I'm not a lawyer, to be able to compose documents that will withstand the test of a trial by jury, whatever it is. And so it's incumbent upon me to do my homework to read this. It's supposed to be difficult, not supposed to be a walk in the park, even though we are in a park. Let me just read this one paragraph. I'm going to get a sip of water from time to time here. I just got the good news, the microphone may not show up, so here's to hanging tight.
Ask questions soon?
In about 5 minutes. I'm just going to set a couple parameters, and I will answer everybody's question who has one. As an example of a lot of the things that are distracting us from the true things that must be debated about health care, it has been said that this bill contains mandatory euthanasia counseling. This is what it says. Under Medicare programs, an explanation by the practitioner of the continuum of end-of-life services and supports available, including palliative care and hospice, and benefits of such services must be made available upon request. That's a big difference. Now, we learned this. So, to answer the question of why would that be in there? We learned that the hard way. Hospital administrators and doctors came and said, this must be in there because we have far too many Americans who arrive at a situation where they cannot speak for themselves in medical situations. And therefore, the hospitals, the doctors, and the families are caught into a trap. And therefore, upon request, those services should be available. Now, that's a far cry from what I read on the internet. And so I make myself available tonight to answer the questions I can answer and to take for homework the ones I can't. Now, Please, no shouting. I will try to get to everybody's hands.